We're going to talk a little bit about a new outbreak, 9 confirmed cases of measles in Hennepin County. Those cases are in children who are aged 1 through 4, and none of them were vaccinated. 8 of the confirmed cases are in Somali Minnesotans. The health department says that community has really been targeted with misinformation about vaccine risks. So it's working to alert families to this outbreak and try to make sure that no other kids get sick when they don't have to. Dr. Gigi Chawla, the Chief of General Pediatrics, and Patsy Stinchfield, the infectious disease nurse practitioner and Senior Director of Infection Control at Children's Minnesota. Both of you here to talk about this because it's that important. It really is. Thank you, guys.
It is. Thanks for having us.
Thanks
today.
for having us.
Dr. Gigi, let's start with this question of people who are concerned about the vaccine. People, certainly, one of the concerns has been, is there a link to autism? We know the science says there is not.
You know, we know our MMR vaccine to be safe, and it's the most effective treatment to really ensure that it prevents against measles. And so we urge people to think of it in that way. It's really the best treatment that we have.
Patsy, can you tell us a little bit about what measles is exactly? What are some of the symptoms? Because it's not something that we see very often.
Right, it's pretty rare to see it. It starts as the common cold, runny nose, cough, red eyes, a little fever, and then a characteristic rash that looks like a bucket of rash poured over your head. Starts in the hairline, down the face, goes down to the trunk. And the fever may be low or high. There's nothing really specific about the fever.
It's that rash that you can really distinguish and tell that it's measles.
Right.
And how does it spread to other people?
Very easily. The most contagious virus we know just by breathing. So if you had measles and we were sitting here unimmunized, we would all get it just by being in the same airspace.
Wow, there's really a sense that this is another one of those things that we had essentially eliminated, but here it is. Dr. Gigi, what do we do if we think someone we know is experiencing these symptoms?
Yeah, you know, I think the first thing really to do is to call your clinics and get to your triage nurses. They're really well equipped to talk you through and understand whether or not the symptoms really match what we're thinking about for the measles outbreak, and then take the next steps to direct further treatment plan. They might have you contact the health department. They might actually bring you into clinic, but that's really the first step.
It's that big of a deal. Patsy, how do you treat the measles?
Well, there is no antiviral medicine for measles. We have antivirals for HIV and for influenza, but there is nothing for measles, so it's supportive. IV fluids, ventilators, and care at home as needed.
Does it often run its course then, or what happens?
For most people, it does run its course, but the children we've been seeing in the hospital have been dehydrated, they've had pneumonia, and we've had children in our ICU on ventilators before too, so it can be very severe.
Dr. Gigi, when should people get vaccinated? Is this something right at, when they're young kids?
Yes, so the measles, mumps, and rubella vaccine, the MMR vaccine, should be given to kids at 1 year of age, and then standardly before they go to kindergarten at 4 to 6 years of age. But now the Minnesota Department of Health has released the newer recommendations just yesterday that say that all kids in Hennepin County should get that first dose right at age 1, and the second dose a minimum of 28 days later, so right around a month later, they should be getting their second dose. All kids in Hennepin County, and all kids who are of Somali descent all over the state of Minnesota should get that second dose very quickly then.
Okay. All right. Dr. Gigi, Patty, thank you so much for coming in.